question I was asked recently from a patient, and that I've seen on social media as well in the past, is a patient who has a diagnosis of rheumatoid arthritis about 2 years ago, originally tried disease-modifying treatment, didn't really work out for them, had some side effects, wasn't comfortable with it. They ended up switching to more supplements. They ended up doing a plant-based diet. They're feeling better, and they want to make sure that they're still okay from their RA end, because they know how aggressive this condition can be. So there's a few things. First and foremost, understand that the natural course of rheumatoid arthritis can be one that can be progressive, sometimes can go into remission, but frequently, if it's not treated, can lead to progressive damage. In this individual's case, it sounds like they have tried treating it conservatively with diet, supplements, and are feeling better, but I do agree that they should still be monitored to make sure that they're not having progressive disease. So first and foremost is make sure you're working with an expert, a specialist, a rheumatologist that you trust, that knows what they're doing and knows how to handle your situation. In addition, there should be a physician that does not have there's only one way to do things, but there's someone who can work within your framework of what your philosophy and your desired care needs to be. Next is, if your condition's under good control, meaning you're feeling good, that's excellent, but there's a few other ways as a rheumatologist that we would judge whether or not your condition is under control. So besides how are you feeling, it's also how are you functioning. If you have limitations, that may be a sign of active disease or more chronic damage. We then also want to actually examine you to see if there's any signs of active inflammation on either your joint exam or tendon exam. In addition, we want to look at your labs. Are there any signs of inflammation on labs as well? And then lastly, and what I consider sometimes maybe even the most important, is how does your ultrasound look of your previously inflamed joints? The reason why is because my exam might be good, the labs might be pretty good as well, but the reality is that some low-level inflammation may still be there that is undetected by some of those other testing, and we can find those via ultrasound. So to begin with, if there's signs of active inflammation, either on exam or ultrasound, then I would say, a conversation needs to be had about whether or not you're heading in the right direction, whether treatment should be reconsidered or not. And that is a risk and benefit decision you need to make along with your rheumatologist to make sure you're achieving the goals that need to be achieved. The next issue is then, let's say your condition is actually under good control. Symptoms, exam, labs, and imaging on ultrasound. And again, the key imaging here is ultrasound, not x-rays. X-rays only show chronic damage. They will not show active inflammation. That can only be seen on ultrasound and MRI. MRI can sometimes be hard to get. Ultrasound is a great bedside tool for your rheumatologist to have to judge the level of inflammation that you have. So let's say after that evaluation, condition is under good control, what should you do? My recommendation is you should still be getting intermittently checked out by your rheumatologist. Let's say your condition is in remission, you're doing well, then it's probably worthwhile to check in with your rheumatologist once per year to make sure things are remaining under good control. Again, based on your symptoms, your exam, your labs, as well as your ultrasound. If all that checks out, then I think you're on the right path and you're okay to continue as you are. If there's signs that maybe there is some active inflammation, that maybe things are not where they need to be, then your rheumatologist should be able to devise a solution for you that should be able to keep you headed in the right direction.